All right, thank you very much. So, the last session. Lucky last. I'm not sure if that's a good thing or a bad thing. What do you think? We'll take it as a good thing. Okay, so the title for my third and last presentation is Sanitarium from Weet-Bix to Wellbeing, and the direct to community Australian nutrition and health experience. So in this presentation, what I want to do is expand on Sanitarium's portfolio of integrated health and wellbeing services that we gave a very brief overview the other day on Wednesday. And in this session, we're going to particularly look at the direct to the community programs. Yesterday, we talked about nutrition advocacy, which is a very public health orientated approach. And in this one, we'll look at direct to the community programs. I'm going to add in a couple of extra things that'll just give you a bit of a background as to why we take the philosophy and the approach that we do. And that includes looking at what we call the changing paradigms of health. And by that I mean what people aspire to from health and how they define health and how that has changed, at least in Australia and New Zealand, over the last century. And in addition to that, I'll unpack a little bit more about what I mean when I say whole person health, because that's at the very core of what we're trying to share with people. So just as a very brief recap, of reminding ourselves what it is that we're trying to achieve overall. You'll recall that there were 4 key things that our program, our integrated program, was trying to deliver. So it was to make, obviously, a real and tangible difference in relation to health. Secondly, it was to bring to life this concept of genuine care for whole person health. And then Sanitarium wanted to be helping to lead out this type of care in the community, and we needed to make sure that we were in a sustainable position, that there was a return coming that would enable us to continue with the programs and be able to expand on them. Okay, so what is it that I'm talking about when I talk about the fact that we want to take a whole person approach to health? Now, just to set the scene for that, I'm going to share with you some what we call macro or big picture environment trends in the Australian, New Zealand and also the US communities that apply to the background of where we're providing these services. And at the end, I'm going to ask if you think that this is somewhat similar or different to what you experience in Romania, but it's certainly what we experience in Australia. So let's start here. In Australia in 2008, a research company asked people, how satisfied are you with your personal level of health? Are you very satisfied or are you very dissatisfied? And right at the top was the very satisfied, and at the bottom was dissatisfied. And what you can see is that since 1996, there has been a constant and continual decline in the way people feel about their health. So, you know, for all of the advances in healthcare and medical care, people still aren't feeling necessarily really good about their health and well-being. So here's some similar data. This was a survey that was conducted in the United States, and people were asked about their level of well-being and asked whether they felt they were either flourishing or, yeah, I'm okay, or whether they were just hanging in there and just surviving. And this research was done with adults, and there was about 3,000 people, so it was a reasonable sample size. And what I find fascinating about this is that 75% of the population said they were either okay or only just hanging in there, and it's only a quarter of people that were saying, yep, I'm feeling really good. So that's not how we want it to be, is it? Okay, so with this fairly glum picture of people's feelings about their health and well-being, the Australian government in 2008 did what they called a national listening tour. And so this was conducted by the group that I was talking about yesterday, the National Health and Medical Research Council, and they ran 150 events. They were focus groups with different community people right around Australia, and they asked people, what is it that you're looking for from a health system? And this was the top 5 answers that the respondents gave. The first was that they said, well, the first thing is we want a wellness system. We feel that healthcare in Australia is geared more to an illness or a sickness system. So once I'm sick, then there's hospitals to look after me, but that's not just the sort of care I want. I want someone that can help me to have life to the full. They also said we wanted to be considered as whole people. Interesting, isn't it? Not just fragmented pieces. Looking after the physical health at the doctor and the mental health at the psychologist. It all needs to be kept together. They also said they wanted a combination of conventional medicine and to have that complemented with allied health and complementary therapies. And then they also said they wanted to have access to their own health records and to be able to help manage them. So they're saying, I don't just want the experts out there making all the decisions for me on behalf of my health and my body. I want to be involved in that. I want to be part of it, and I want to see what you're saying are the issues that relate to my health and well-being. Okay, so this research was further enforced with some other research in the US in 2005, saying that people said it's not enough to have less sadness and less worry and have suffering or disease removed. What we want is more satisfaction, more contentment, more joy in life, and to live a life with meaning and purpose. So this is a really interesting picture, isn't it? When we consider our roles as dietitians, we can see that what people are actually looking for is so much more than just help me with my physical needs and my body needs. We fairly constantly run research as part of Sanitarium's work in Australia, and what we consistently hear people say is, well, I'm not actually sick, I haven't actually been diagnosed with a particular disease, but I just don't feel well and I want someone to help me feel better. So in Australia, at least, it's a marketplace reality that there's an unmet need. So there's a lot of health services that can help take someone if they're critically ill, if you've got high blood cholesterol or if they've had a heart attack, to get them to a neutral point on a health continuum, but there's not a lot of services that then can take them further along to what we call optimal health and well-being, that concept of living life to the full and abundant and joyful living. So I'm not sure how that is for you here in Romania. Can someone maybe tell me whether, is this similar or is it different? Any takers? Maybe I can chat with you a little bit more later. And similar? Fairly similar. Okay. So it's against this context, I guess, that Sanitarium wanted to, getting the computer to catch up with me, to lead what we call a shift in the paradigm of health. And this is where I'm just going to talk a little bit about how it's changed over time in terms of how people define health and what it is that they're saying they want from health. So if you think over the last century, we've moved from what the traditional societies would have regarded as health. And it's interesting, I think we actually do a bit of a full circle here, but bear with me. And then we moved into the conventional health paradigm, where health was defined as the absence of disease. And it was the physical part of health that really received the focus, and it was all about curing or managing disease. And so doctors and the medical profession are very strong in being able to care for this. Then towards the end of that century, there was, we believe, a new paradigm for health came in, which we call the alternative health or the preventative health paradigm. And this is looking to avoid or prevent disease. So the conventional one was about treating disease once you've already got it. This one was about trying to avoid it. And this paradigm also includes the mental health side of things in particular. And so this is where allied health practitioners, be it dietitians or naturopaths, joined what essentially is the healthcare team. Then from that, this is my terminology for it, we've moved into what I call the happiness or the integrated health paradigm, where what people are really aspiring to is to be happy. Now, we have in Australia what is called the Happiness Institute. We have a doctor who heads that up who calls himself the CEO of happiness. You don't have that, no, that's probably good. But the interesting thing about this, and this obviously includes, the field of psychology and that kind of thing, but I think that there's still something missing here, because as much as we might like to, we can't necessarily just think ourselves happy. It's almost a little bit superficial, some of this paradigm where we are currently. And so what we want to help to lead to is a different paradigm that takes a more holistic picture. And I'm not going to read all of this in detail, but what we're wanting to help shift and lead the community thinking to is a paradigm of whole person health and this meaningful and purposeful living. And we know from research that people are saying this is actually something that they want. So this takes a very integrated approach to health. It includes, of course, not just the physical and the mental, and it also includes social and vocational and emotional, and also the spiritual side of things, because it's really that spiritual side of things that gives us a framework for living, that helps us to understand what's my place in this world, where have I come from, where am I going to, and what is my purpose while I'm here right now. And so this is what we're really wanting to help provide services that meet these kind of whole person needs. Now you might be wondering, well, do people really aspire to this sort of soul part of the body, mind, heart and soul side of things? And there is definitely research to show, at least in Australia, that is the case. This research shows that 67% of people in Australia said they wished they had more experiences that could feed their souls. Interesting, isn't it? We talk about feeding the body, but people are also looking for connections and meaning and purpose in their lives. And 69% said it was important to have some kind of spiritual belief as well. So we believe that the need is there, and it's within that paradigm that Sanitarium is then wanting to offer all of these different programs that we've spoken about, and to help people to experience this kind of health. Okay, so having set the background there, let's come back and look at a little bit of a deeper level of some of them, and I won't go through all of them, but some of the key programs, the direct-to-community programs that Sanitarium is running. And the first one, as you'll recall, was the Sanctuary Health and Wellbeing Village. So you'll remember that this was a place to come for people to experience whole person services, where we brought together conventional medicine and complementary therapy, and we had the full team of health practitioners in the one location, where people could see them on a one-to-one basis, or there was programs designed to cover the topics that would be relevant. You'll recall that we said that we wanted that the one we've set up at the moment is a pilot, and once we've worked out the model here, because it's a new and different thing, there's nothing else really like this in Australia. Once we're sure on what the model is, then we want to roll that out to about 10 to 15 in Australia and New Zealand. I shared with you that we're having good growth, and that our plans to move from about 12,000 consultations per year, which we have at the moment. In 3 years' time, we believe we'll be running about 36,000 consultations from this one small centre. So, and I think I shared with you that we've worked out that we're reaching about 20% of our population, of our local population, when we reach that position. So we're calling these concepts small centres of influence that can help move people to this holistic health paradigm, particularly as we roll them out. Now, there's a fairly unique health model that underpins this, that really is about bringing together two elements, and I just wanted to quickly share that with you. The first one is that we're looking to move from a traditional GP model, which would generally have the GP at the centre, and probably not necessarily, this isn't true in all cases, but not necessarily tending to refer to other specialists such as dietitians or psychologists. This is certainly the situation in Australia. I can't speak for if it's the same here in Romania. But we're wanting to move to a model that we're calling the client-centred model, that puts the needs of the client at the centre, and then probably their key practitioner is still the doctor, but there's a high level of inter-referrals between the doctor to the other members of the allied health team, particularly the doctor, the dietitian and the exercise physiologist and the psychologist and that kind of thing. So a client can come along, we do an assessment with them, we look at what their needs and their motivations are and what the barriers are, and then we can tailor a specific health and wellbeing journey that's unique to them, that can help meet their needs. So that's what we're the healthcare model that we're trying to bring to life, and we want to bring that to life also in the context of our philosophy, which you would have heard me use these terms over and over again, one of genuine care, not just a duty of care, the concept of lifestyle medicine, the fact that all of this is integrated, and that this then gives the person this concept of living more and living life to the full that they are looking for. So a couple of you, and yesterday in the interview that I did, I was asked, well, how do you promote this to the community? So I thought I'd share some of that with you. Interestingly, the most effective way that we have of promoting this service is the people who come along to the centre and are really happy with the way that they've been cared for, which we call word of mouth. This is the biggest source of new people coming to the centre for us. But there are many other ways that we promote it, through signage in the street. We do letterbox drops and to local households and businesses in the area. We have our GPs write letters and to the people in the local community saying, you know, we'd like to look after you. And of course our website is a very big one for us as well. We also have our practitioners, whether it's the dietitian or an exercise physiologist, go and run presentations in various community groups to topics that they are interested about, and then we also get to tell them about the service that we provide that's local, and we would love them to come. At the moment, we're also trialling a radio campaign. I'm not sure if that's going to work, but a lot of these things really are trial and error at this point, and that's the whole reason why we're doing a pilot, because we need to know what's best for when we come to do more. So this is just meant to give you an idea if we have a continual promotion or marketing program on a 6-week cycle, and I won't go through that in detail, but you can see we take a very deliberate approach to what we're doing well, just to build awareness. And you can see, for example, that when we do letterbox drops, which is where there's a red line, after we do these letterbox drops to households and businesses in the local community, we then get a spike of new clients coming. The graph at the top there is new clients, and the graph at the bottom is our total number of clients. So we know that it works, but we're still working out what works best. Okay, so I wanted to share, the website is a very important way for us. I think it's the second highest way that people come to the centre, so we're constantly, this is our homepage, and there's different promotions that are promoted there. You can see it's massage therapy in this instance. But within the website we talk about all of our practitioners and their qualifications and make them human, so that it's not just they're very good scientifically, but they're going to be very warm and somebody that you will be happy to have caring for your health needs. I'll just flick through these other web pages, but it just gives you an idea of the website, and this is also some flyers material that we do the letterbox drops with. Right, now this is where I may need some help. What I wanted to share with you was a little video. It only goes for about 2 minutes. That will it goes through the centre, and I thought you might like to see a little bit more of it and the way that we promote ourselves. This video is actually included on our website. The Vimeo. I think it's, oh no, sorry, bottom one. Yep. Perfect. Thank you. Thank you. Luke has been my absolute friend and helper this week. I'm very grateful to his help. Thank you, Luke. So you can see, I think, from the video that we're not just promoting the practitioners for avoiding disease. It's really about life to the full. Yes, that's right. I'll just click us through. Yep. Bit up, yeah, bit more. Next one, I think. Maybe go one more and just check. Yep, that's great. Thank you, Luke. I will be calling on him a couple more times to share some things with you. Okay, so that was Sanctuary. So moving on to give you a little bit more information about our workplace health service, which is Cultivate. You'll remember that we talked about how this is a corporate health program and about how businesses will engage us to come into the workplace and provide services for their employees. And I shared with you some of the things that we do. One of the key things that holds all of the programs together is a calendar, and I'll share that with you in a moment. We talked about our goal here was to be leaders in the corporate health market with whole person health services, and that our aim was to have 50 to 100 clients in 5 years' time. And when we spoke on Thursday, I told you that in January we had 18 clients and we employed 6 health professionals, and then suddenly in June we had 100 clients and 100 employees, and I said I was going to share with you how we did that, so I will do that in just a moment. this is an example of what our calendar program looks like, and you can see there's a different health theme every month. And so all of the other things that we offer get packaged in the context of this overall calendar. And depending on the business that we're working with, because of course we have our own branding, but we also have the branding for the company that we're working with. Now, I wanted to just share with you the results of what I said is our most effective health service, which is personal health coaching. So I'm going to share with you the results of a trial that we did recently within Sanitarium, and I think it will be of interest to you because there's a team of 2 that work on a personal health coaching project, and it's a dietitian and an exercise physiologist. So I thought you'd be interested to see. I possibly was going to ask Luke to help me flick to a PDF that would mean that you could read this, but because that might take some time and I've got it in front of me, is it all right if I just speak that through? Great, thank you. All right, so for those of you who've got your binoculars, you'll be able to read it up there. For those who haven't, you'll have to unfortunately listen to my voice. So we had 72 people in a factory environment. So these are the people that are actually making the Weet-Bix, and this trial was done over a 7-month period, and it was a face-to-face coaching program. So it had 2 health checks, a pre and a post, and in between that we had 5 20-minute, it was only 20-minute sessions of health coaching. So that's not a lot of time, but I can tell you that you'll be delighted to hear what a difference the dietitian and the exercise physiologist were able to make. So before Sanitarium did the health coaching, we had 25% of all those employees were at a high risk of disease. They had 5 or more health risk factors, and then on top of that there was an extra 42% of people who were at medium risk, meaning that they had 3 to 4 factors for disease. So that's a lot, isn't it? And when we calculated the cost of that, it was about $15,000, was costing Sanitarium about $15,000 per person per year, because when somebody has high risk factors for disease, it means that they're less productive. They're actually less healthy, they're away more, which we call absenteeism. When they are at work, we have what we call absenteeism, which means they're there, but they're not really there. I'm sure you can relate to what that feels like. And so the cost of that is lost productivity. And if you total all of that up for the 72 people, it was over $1 million per year that was costing the Sanitarium. So after the health coaching, the number of people that were at high risk went from 25% to 6%. So a big reduction. And then from those that were at medium risk, they went from 44% to 34%. And when you calculate the saving for that, it was about $3,000 per person. So it saved Sanitarium about $100,000 for that year, and was a return on the company's investment in that of about 4:1. So we've shared those results with our own company, Sanitarium, and they are now keen for us to roll this out to the other sites and to other employees. So it shows that you need to even market yourself within the organisation that you're working with. Just to give you a little bit more detail to that, the number of people that had indicated that they weren't doing enough physical activity reduced by 37%. The number of people who had high blood glucose levels reduced by 20%. The number of people who had a waist circumference that was too high, or excessive sleepiness during the day and anxiety that was obviously stopping them from working properly, reduced by about 16%. And probably the key thing was, which Sanitarium was really excited about, was that 91% of these employees felt that this meant that Sanitarium really cared about them. And this is a very important thing for a company, to have people feel that the company cares for them. and so that was a great result to see. Okay, so moving on, we, as I said, we have had growth. This is a graph showing our revenue, which reflects the number of services that we've been able to sell. Has been increasing, but you'll see that there's been a bit of a plateauing there. So we had a bit of a look at the marketplace and found that there'd been some significant changes that had happened between when we started and what happened a couple of months, about 6 months into the program. What had happened was we had really large insurance companies that had come into the market. Like, I don't know what the equivalent would be here, but for Australia it's Bupa. Do you have that here? No, I know they do in the UK. Bupa and Medibank, and these are big multinational insurance companies, and they came into the market and they bought up a lot of the small corporate health providers. And they had an agenda really of selling people their health insurance, and the foot in the door was to provide some corporate health programs for people. But as a result of this, because they would buy up all of these players and then they could offer them all to people, and when I say small players, at that point in time, the industry was made up of people who would specialise in various elements of corporate health. So we'd have someone who would, a company that would run skin health checks only, another company that would run corporate psychology programs, another company that would do pre-employment medical checks, etc. So they came in, they bundled up a group where they could provide end-to-end services to the client. And so for those of us who weren't able to do that, and it wasn't just us, there were others as well, it was pretty clear that we wouldn't survive in that market because the clients were looking for somebody that could do that. So as a result of that, we shifted our strategic focus from just trying to grow organically to growing through acquisitions and partnerships. And so our strategy was to acquire, similar to what, but not quite to the same extent, to bundle up with other companies and provide an end-to-end service that would enable us to do that, but also to have much more of a geographical reach, so that if the company had employees in different parts of Australia, that we could meet the needs in all of the areas. And so there were 3 businesses that we have partnered with, and I'll share more about these in a moment, but their names are On-Site Health Solutions, Provax and Vitality Works, and there are another 3 companies that we're currently in discussion with at the moment. So this is the way that we're looking to survive, I guess, in the market. As we said, the start is hard. The start has been very hard on this particular initiative. So this slide just gives you an indication. If you look at the yellow boxes there, you'll see that this was our Cultivate business where we started. We had a presence only in Sydney and in Melbourne, and this is where we had our 6 health professionals working from. Now, with the integration that we've just gone through, we have a presence all over Australia and New Zealand, and this is how we now have the 100 clients and how we have the 100 practitioners. You can see it's a very different picture. The other thing that is very different for us is that whereas we previously just had the box on the very right-hand side of programs that were ours that we could offer to our clients, we of course now had access to some wonderful programs from the other groups as well, and they built up so many more programs than what we had, because a lot of these businesses had been in operation for something like 10, 15 years, and so they also have very strong evidence of the benefits of their programs. So that significantly helped us as well. So just to give you a little bit more of a background, the On-Site Health Solutions group, and this is some pictures from their website. The emphasis with this group is on blue-collar industry. I don't know if you have that term here. Blue-collar it's not an office worker, it's more someone who might be working in an agricultural situation or a factory situation. or in a mining site. So it's not someone who just sits at a desk. We call someone who sits at a desk all day a white collar, the shirt, think of it sort of like that, a white collar worker. So on-site health solutions are experts in this area, and their programs include safe spine, so to prevent injuries in a mining site and other factory situations. They also have a fabulous program called The Biggest Winner, which turns losing weight in a healthy way into a bit of a competition, and the people just love this. And also another big area for them is fatigue management. So that gives you a little bit of an idea of the on-site health solutions. The other one that we bought is called Vitality Works, and this is a white collar one, so think shirts and people sitting in offices. So what sort of problems do you think people who are sitting all day are going to have? Depression, that's you're very right there. Previously this has been called stress management programs, but more recently the term that is used is resilience. So of course there's always going to be stress in a work situation. It's just how you deal with that and building up your resilience to be able to deal with that. So that's an important one. What else? Can you think of anything else that would be a problem for someone who's sitting all the time? Obesity, absolutely. Weight loss programs are an important one here, and there's one more in particular I'm thinking of. Yeah, exactly. So ergonomic programs are important for this area as well. And so there's just a couple of other clips off their website here. And the other one was Provax, which is a flu vaccination company. But they also do other things like biomedical health assessments and lifestyle health assessments. So this was good for us because they actually have a network of 200 nurses across Australia and New Zealand that gives us the ability to be able to offer other services in that area as well if we need to. So this has really changed things for us, which is very exciting. It's helped us to significantly strengthen our offer. And hopefully explains why we've moved from the position we were in to where we are, and it also hopefully means that we can continue with that growth and hopefully get into this position of being a leader in our country for that. Okay, now kitchen I'm just going to skip through very quickly because there's not anything else really that I needed to share there with you. I did say I'd talk more about our Sanitarium nutrition service, and this is probably of much interest to you because this is where our dietitians mostly have worked. And I shared with you that the real focus for this program is to promote the benefits of plant-based eating, and so there's a number of different communication approaches that we take to do this. The main one is that we run every fortnight in the biggest national newspaper on a Sunday in Australia. There's a little magazine that sits on the inside that's called Body and Soul. So every fortnight we have an article in there on different health and nutrition topics, and we promote our resources as a part of that. And this has really helped us because it's read by about 6 million people, and it's helped to raise our profile in Australia. So we get, because of these, this promotion in the newspapers, we get about 85 to 100,000 requests for our books each year, which I've included some pictures of there. And we find that typically the growth of this is an extra 25% requests each year. We also have a newsletter that we send out a hard copy and also as an e-newsletter, and it's called Good Food News, and we have 80,500 subscribers that receive this, and the increase of this is about 15% per year. We also have another e-communication called Recipe of the Week, and we have about 60,000 subscribers for this one. And this one is very popular. It's increasing at the moment by about 25% per year. People want to know. Recipes might, sound perhaps a little bit ho-hum to us, but it's what people are looking for, because they want to know what's the translation of the science into something that's tasty and healthy for me to eat, that is fairly easy for me to make to feed my family, and that doesn't cost too much. So if you can get recipes that fit into that category, people just love the communications that you have to share with them. We also get about 55,000 people a year ring up to ask a question of our team of dietitians on anything from food and nutrition. It's not just for Sanitarium products, but they can ask about anything in general. And we have a range of different brochures that we can send out to people as well. I might skip through these things, although this is probably worth mentioning in that the leading software supplier for doctors in Australia is a program called Medical Director. And they actually approached Sanitarium and asked us to develop some patient education sheets for them to hand out, to print off and hand out to a client if they wanted to give more information on things like high blood pressure or lactose intolerance or glycemic index. We had probably about 40 different of these fact sheets, and we understand that there was about 17,000 of these being printed off per month. That should be, not per year. So yeah, that's a good way to reach the community as well. Okay, so I did indicate that we were looking to move from just being nutrition to get into the realm of lifestyle medicine. So this would mean that we keep everything that I just talked about, but that we would add to that a program that was highly interventional in nature and would help people to, more than just sending them information, would be able to do to get them to make behaviour change. So I'm just going to share a little bit about that. I indicated that the CHIP program was the program that we were bringing into what we were offering to provide that, and that this really is all based on a concept of lifestyle medicine. Now, I know you've heard a lot this week, or a fair bit this week, about lifestyle medicine, but I'm just going to walk us through a scenario that hopefully will just even further bring this to life for you after giving this definition. So, lifestyle medicine, what is it? It's the use of lifestyle interventions or prescriptions. So think of how a doctor gives out a prescription for medication. Well, this is giving out a prescription for diet and the right food, or to exercise, to do things that will help manage stress, etc., etc. And it can help with the management and the treatment and the reversal of all of the diseases that are listed there. So this is the scenario I want to ask you to picture. So just pretend you're not here. Pretend you're sitting in a doctor's room, and that the doctor has just told you that you've been diagnosed as having high blood cholesterol. And he or she has given you two options for addressing this. And I want you to think, as I talk through this, if this were you, which option would you prefer to take? Okay, so option one, it's going to cost you, now these costs are based on Australian, but hopefully you'll get the point. This option one is going to cost you about $2 a day, and so that's $60 a month. And this is an option that you're going to need to continue with for the rest of your life. Now, if we assume that you're 42 years of age and that you're going to live until you're 70, the lifetime cost of this option is $20,000. Now, this option has numerous side effects, and I guess you describe them as negative. Now, they don't happen in all cases and to all people, but there is a possibility that you could experience some things like muscle pain or nausea or a stomach upset, etc., etc. Okay, so that was option one. How's that sounding? Okay, so let's look at option two. Option two is going to cost you nearly $400, but it's a one-off payment. And it's going to potentially save you about $100 a week compared to your usual eating expenses. So again, we're going to assume that we're 42 years of age and that we're going to this time live till we're 75, and this gives a lifetime saving of nearly $40,000. This one has side effects as well, but they're positive. The side effects in this case are increased length of life, which is why we were able to change from the living to 70 to the 75. But not just that, because people say, living longer, do I really just live longer or do I just feel like it? Because I can't do this and I can't do that. But it's talking about increased quality of life as well, weight loss, lowered blood pressure, blood glucose levels, etc., and having an increased sense of energy and vitality and improved mood. So they're the two options. And so the question is, which option would you take? Now, I don't need you to put your hand up and necessarily tell me what the answer would be, but I do want you to tell me, what do you think option 1 was? Yeah, exactly. It's a cholesterol lowering drug, a statin. What do you think option 2 was? Lifestyle change, exactly. Now, the specific example I'm using there is the CHIP program, which is what had the specific cost that it did, but there are others that could be used in place of this. Now, I really need to emphasise at this point that I'm not saying that there's not a role for medication. There is. And if somebody is on medication, it's not just a simple thing of going, right, well, I'm going to go off that and I'm now going to just do this. If there are any changes in medication, then that needs to be managed very carefully with somebody's doctor. But what I'm trying to illustrate is that there is another option for doctors and for dietitians to be able to share with people and then to work together to be able to get those changes. So really, it's like an analogy of a tree and a root system. Let's just think about this. If you think about how healthy the leaves and the branches of a tree are and how tall it grows, that's impacted by what we feed through at the roots. So if the leaves and the branches aren't healthy, it means that what we're feeding through at the base of the tree is not healthy. So it's interesting to compare the two options, because if we're talking about something like a statin, it's really acting at the level of the branches and the leaves. It's not actually, it's helping to manage the symptoms, and that's important, but it's not getting in at the root cause of the disease. And so the second option, which is the lifestyle change, is actually starting to feed different things through the root system. And so it takes a much more systemic approach and addresses the root causes of disease, and instead of keeping on having the disease progress, we're able to reverse back those processes. And so really we can change the fruit that the tree yields, either health and well-being or disease and not health and well-being, by what we feed through the system. So it's a powerful message, isn't it? The thing that amazes me about this is that a lot of people say, well, my parents have high blood cholesterol. It's a genetic thing. There's not really anything I can do about that. But we heard the gentleman, I can't remember his name now, but from the Romanian Heart Foundation, talk about the fact that genetics is actually only a relatively small part of what is causing disease in us. And not only does it take a fairly small part relative to what lifestyle can do, there is research now to show that what lifestyle choices we make can either turn on or turn off those genes. Now that's hugely significant. This is a whole developing field at the moment, and there's a lot of interest in it, and that's why in 2010 Time magazine published this article, Why Your DNA Isn't Your Destiny. So our genes, of course, we have to take them into consideration, but that's not a sentence for the rest of our lives. There are hope that we can have if we find ourselves in this situation, but hope that we can pass on to our clients and our patients as well. So that provides a good context to the concept of lifestyle medicine. Monica, can I just check the time? How are we going? It's like 10 minutes to go? Okay, great. That will be about perfect. No, that will be good. Thank you. So having said a bit more of a scene on lifestyle medicine, I just wanted to talk a little bit more about CHIP, because CHIP is something that we do hope in the relatively near future to be able to work with health professionals here to provide to the community in Romania. So I thought you may be a little bit interested to hear more about it. So clearly it's a lifestyle medicine program. I shared the other day that it was developed about 25 years ago in the US by a doctor of public health. And it's typically a 30-day lifestyle intervention program. There's a base of about 60,000 people that have been through the program, and I'll come to that in a little bit. Now, you'll see there that I've actually got two names for it. When CHIP was originally established 25 years ago, it was called the Coronary Health Improvement Program, because at that point in time, heart disease was the predominant issue that was facing people in the community. And so it definitely has the potential, it definitely can help with that. But 25 years later, there are now so many more diseases facing people in the community: diabetes, obesity, depression, arthritis. I'm not so sure about the figures in Romania, but in Australia these are incredibly high. Our levels of obesity, we actually jostle between first and second place with the United States for being the most obese nation in the world. People tend to think of Australians as being very fit, and there are many who are, but there are also many who aren't. So this is of particular interest to us, and the program has been able to show that it has effects in these areas as well. And in fact, there's even been a journal article released probably about 6 months ago now that was in the Journal of Psychology, that was submitted by a psychologist who was able to show that this program is able to help manage depression as well. And so I need to highlight it's just one study at this point, but clearly there is potential there. And if you think about it, I mean, we all know that what we eat can impact our mood. Okay, so I thought you'd be interested to see what the American College of Lifestyle Medicine said about the CHIP program in March of this year. And this was in response to the American Journal of Cardiology paper that was published in January. And they said the clinical results of this large 5,000 free living cohort in North America has yielded some of the most impressive recorded clinical changes ever in the literature. Isn't that amazing? And so we really are excited about the potential of this. Okay, so what sort of results? Oops, this is going to be a build-up slide. This slide here gives the overall results for the 5,000 participants that went through. So it's the average, and I think you can see by glancing at the screen that there are some good reductions there, particularly as it relates to total cholesterol and LDL cholesterol and the triglycerides and the fasting plasma glucose. So we're seeing decreases in all of those areas. But what is really exciting is when you consider those that went into the program at the highest level of risk factors. So, for example, when the researchers stratified the group going into quartiles of those with the highest levels of total cholesterol, and then they looked at what happened, and you'll see the circles then around those people, you'll see that cholesterol dropped nearly 20%. Triglycerides dropped nearly 44%, and diabetes, or the fasting glucose, fell by about 20%. So this becomes hugely significant when you consider that 19% reduction in cholesterol, which you double when you consider the risk of heart disease. We're talking about something like a 40% reduction after just 30 days. And so this program definitely has the potential to help people. A little bit more about, well, so what is this magic? What is this magic program? Are there any tricks? Actually, no, there's not, but I'll describe it to you in a little bit more detail. So what it is you can eat as much food as you like. There are actually no restrictions However, you just need to choose from the right foods, and then you can eat as much as you like. So it's whole plant foods that are asked to be the focus of what we eat. But it doesn't just address the dietary aspects, it's whole of health in its approach. So it looks at exercising more, cutting out things that are harmful for us, the smoking and the alcohol and the caffeine, finding ways to manage with stress and that concept of resilience and relaxation that we were talking about, and also behavioural psychology that looks at, so what am I motivated by and what's stopping me from doing the things that I want to do, and getting people to consider that and be coached through those things so that they're likely to move from just knowledge to actual behaviour change. Okay, so CHIP encourages healthy eating choices. Now, whilst I've said that it encourages people to mostly eat plant foods, it doesn't say you can't come on the program unless you're going to cut out all animal foods altogether. What it's encouraging people to do is to move from the left-hand side to the right-hand side. So if you're if you're not a vegetarian and you're eating meat and you're having lots of meat, then it's about really minimising that and using it more as a condiment instead of it being the focus of a meal, and looking at the type of meat that you choose. If you're a lacto-vegetarian or a vegan, because can I ask you, are all vegetarian diets healthy? No, they're not, because you could have someone who's not eating animal products, but they're eating what we call, not so healthy foods. And so even if someone is a vegetarian, we're encouraging them to move to the healthier choices within that, and to eat mostly from the fruits and the vegetables and the legumes and the whole grains. And we make it very, very clear to people that you're going to have worse health outcomes if you're including the meat and the dairy and the processed foods, and you're going to have the best chances of the positive health outcomes if you're mostly, if not totally, eating the plant foods that I was just talking about. And so it is a program that really does leave the choice to the person, but just emphasises to them that the further along the continuum that they go to just eating whole plant foods and cutting out the more harmful things is going to give them the best possible results. Okay, now can I just ask for your help again, Luke? I'll just show a testimony story of somebody in Australia who recently went onto this program. That'd be actually the second bottom one. Yep.
I thought I have to. I thought life was just great. I felt well, and then bang, I got told you've got 6 arteries that are blocked and 99% blocked, and so that was a bit of a surprise. I had to have 5 bypasses after that, after getting over the operation and what had to happen there. I went back onto my normal diet, which I thought was great. I had a good diet, I thought. Went back and had blood tests, and I was surprised. My cholesterol was raised, blood pressure was up, and at that point I was introduced to the CHIP program. I went onto it immediately. Straight away I thought, I have to do this. Within 2 months of going on the CHIP program, all halved. My cholesterol was halved, blood pressure was down. In fact, I had to lower my blood pressure pills because I was getting dizzy. So that was great. And then that's allowed me now to get back into the things I love. 2 weeks ago I got back on the bike, and one thing I really noticed, when I used to bike before, I was always out of breath. I went out 2 weeks ago, I hit the hills, and I didn't even get a sweat. I was doing some marvellous riding you know, getting back on the bike, biking with my friends, living life to the full. And to me, that my life is just beginning again.
Thanks again, Luke. Okay, there are other ones that I could show you, but I think for the interest of time we will just keep moving. Okay, so the CHIP program has already been conducted in many places in Australia, New Zealand and in the United States, and it's actually run in a community setting through local churches, which they have been running as health programs just to help people in the community. So I thought you might be interested to see it's been run in over 400 churches in the States and Canada, about 40 in New Zealand. Australia's trying to catch up, only 25. And I can tell you that where we want to go in the future is to make it available much more so globally in the future. So hopefully one day I'll be back soon talking about being able to offer that here in Romania. We have actually already been having some discussions on that this week, but it's not going to happen immediately. Okay, so our vision for this, we would like to think that we can set up what is a best practice lifestyle medicine program for this, that can be run through many different communities, that's reproducible, that doesn't cost a lot to run, that's very important, and so it can be scalable for us to share with people in other places. We've set ourselves a bit of a grand goal. And so we would like to become the leading lifestyle medicine program globally. And so for the year 2017, we'd like to be delivering about 500 programs globally to over 25,000 participants per year, and hopefully soon Romania can be a part of that. We also see potential to really pull together some research and a study that can show even more so that the benefits of this. We've actually now, we're putting into place better ways of measuring the changes that happen for people as they go on this program. And in fact, we're actually working with Loma Linda University on a health risk assessment that will be stronger than what we've used previously, that will be able to help us. So with this stronger and more rigorous amount of research, we hope that we can take that research to policymakers and to governments and to get them to help expand this even further, to attract funding for further research and to attract rebates for people. So in Australia, for example, if someone came to this program, that they wouldn't have to pay the full amount, that would be subsidised by the government, because it's actually going to help the government reduce its burden of disease costs later on. And then the last part of the vision is there will be some cost for the program. It won't be high, as I've said, but we would like to have a proportion of that which we'll call profit for purpose, not to be given to someone to buy a house or a car or something like that, but that can be invested into more advocacy around lifestyle medicine, so that we can share it more with other practitioners, including doctors, to have it available as a complement to primary and to secondary health care. And the last thing that we'd like to do is also to be able to run things like media programs, TV shows, etc., where we're able to share with the community the benefits for people of going on a program like this, so that they are then motivated and inspired to make some of these changes themselves. So that's what we're looking to do. So I'm starting to get towards the end to wrap up, and I just wanted to come back and look at the big picture and say, so how are we going with the things the goals that we've set for ourselves for Sanitarium? How are we going with them? We're still fairly young in what we're trying to do, but what's our progress been to date? Well, you might be interested to know that from the goal perspective of wanting to be leading some of these new health and wellbeing initiatives in the community, we've actually had research that was done just recently, again by an independent group to Sanitarium, that found that the Sanitarium was the most trusted source of credible nutrition information out of all Australia and New Zealand food companies, which is great. But in addition to that, that we came second only to the National Heart Foundation as out of all health organisations. So this was a really exciting result for us. So that's the nutrition side of things. But in terms of health and well-being, the current research says that we're about equal second place. We have, number one is a weight loss company, and the one that we share our equal second place with is a supplement company. So we hope to become number one day, but you know, that's not the most important thing. The most important thing is helping people. And as I said briefly the other day, once we get to the year 2015, if all of our plans go as per plan, we will be delivering to a strategy of reaching more people in more places and helping to make a difference. We'll be able to be providing about 200,000 health interventions per year, 100,000 meals, across Australia, New Zealand and the US, with the sorts of outcomes that are listed there. And then we will obviously be in a position where we can roll out further Sanctuary to have 10 to 15 of them, to further increase the size of our Cultivate business and to roll out our kitchen cafes and of course the CHIP program. And that is when we will really be looking for lots of Romanian dietitians to maybe come, and other practitioners to come across to Australia to help us with our efforts. So please don't forget us and keep us in mind. So this is, as I said, really about helping people to live more and to stay well. And I'd just like to finish with this quote, because the Sanitarium company has dreams, I personally have dreams, and I know that each of you personally have dreams as well. And I'd just like to leave you with this thought: go confidently in the direction of your dreams. Live that life that you've imagined. So with that I'll finish up, but I would really like to thank Monica and also Dr. Dan, who isn't here at the moment, for the invitation to have come. I've really loved the opportunity to meet with you and interact with you, and I certainly hope that this is just a beginning of our relationship together. So I wish you every success in the future and hope to meet you again soon. Thank you.